Hello, my name is Min Kim, the CEO of HOME, a medical mobile van initiative. Our aim is to improve primary care access among the homeless. Those good-looking guys are our team members. While doing my primary care clinical practice at the homeless shelters in New York City, I realized that there is significant demand for primary care service among the homeless. As a veteran myself, this hits close to home. That is why I teamed up with primary care MP students to do this business. Our purpose is very simple: improving primary care access among the homeless by using the medical mobile van with new technology. So, how are we improving primary care access for the homeless people? Our medical mobile van will provide primary care services such as physical examinations and episodic care, also screenings. How are we different from others? We hire community health nurses and social workers to help the uninsured homeless by applying for insurance, state medical assistance programs, and scheduling appointments. Also, they link the homeless with meal services, transportation, and financial assistance. Our patients can conveniently access their medical record and follow-up appointments on a secure server by our developed application, homepage, and computer zone, good for those who do not have access to phones. There are more than 60,000 homeless people in New York City's shelter system. I believe we primary care nurse practitioners can make positive changes. Now, our CFO, Vanessa, will talk about economic aspect of our business.
Thank you, MJ. He gets
Sure.
person.
Now that you're aware as to why New York City is in desperate need of a project like this, let's discuss the finances. What's a business without numbers? So you will see behind us we've calculated our 5-year revenue, expenses, and net profit. Long story short, we're a profitable business, estimating a 44.7% increase by our 4th year. This graph shows our expected net profit in 5 years. As you can see, we anticipate a steady increase up until our 4th year. Our 5th year, we anticipate a decline because we hope to have enough to purchase a new van by that time. As you can see, our 1st year, we're in the red. That is our startup year, and it's mostly because we're expecting a delay in reimbursement from Medicare, Medicaid, and private insurances. Research shows for every dollar invested, there's a $36 return. With our primary care van service, we can save about $17 million annually by preventing ER visits and by providing prevention services. How are we beneficial? Economically, we're profitable. But more importantly, we service our community and help get homeless individuals the care that they deserve. Okay, so we need $1 million to start our business. But we've already received funding and grants. We've been granted a total of $750,000 from the following 4 organizations and private donations. So with that being said, we're only asking for 25% of that cost, which is $250,000. This amount will cover a portion of the startup cost and will help us get into our 2nd year of business. So we're asking for your compassion to start this business. We're here to be the voice for those who have none. We can also safely sustain business and make profit. You can make a difference in New York City by providing a better place to live. And most importantly, we can innovatively provide primary care services to the individuals who will need it the most. Thank you. Questions?
very much for your presentation. I have a quick question for you with regards to your target patient population are going to be the homeless. So how are you driving them to the website if they're homeless and they don't have connectivity?
Actually, we will be located in Lower Manhattan, which is like next to Bowery Mission. Also, we will do outreach program, and then we get the like homeless people to our mobile van, and then we introduce our application and homepage system to them.
So we have a mobile spot in the van. We have a mobile spot in the van. Okay, you guys can hear me, sorry.
Yeah.
I'm sorry. Can you hear me now?
Yeah.
So we have a mobile spot in the van that has a computer there, and we will utilize our staff, which will actually include an IT tech, but also our social workers and our nurses and our practitioners all will be able to show the homeless individual in the van how to access this.
And also, study shows that 44% of the homeless actually, they do have cell phones, and 22 have internet to access. So this would be like a nice way to update them.
Just, is your van a quantum dispensary? So would you, if you found something, would you treat it? Would you give antibiotics? Would you give creams? Would you give lice treatment, etc.?
Yes, we provide primary care services. We will also prepare antibiotics, and then use just all the emergency medication and first aid kits, so we can provide like enough like medication for people who are uninsured. So when we see the patient who are uninsured or undocumented, we apply emergency Medicaid to the government, and then we get the reimbursement. So that's why we are a profitable business.
We also do what is the word I'm looking for? We can do referrals. That's what I was thinking of. Referrals for if we do encounter a problem, we will have city hospitals in which we will do referrals for specialties and stuff.